Coronaviruses are a broad family of viruses that cause respiratory illnesses. They are mostly found in animals, only 6 have previously been identified in humans including SARS-CoV, which led to the SARS severe acute respiratory syndrome outbreak almost 20 years ago. This new virus brings that tally to 7. Known as 2019 nCoV for novel coronavirus, the strain emerged in December, and has been traced back to a live animal market in the capital of China's central Hubei province, Wuhan. The market has since been closed and quarantined. People often catch viruses causing colds and flu, including some known coronaviruses. But when a new strain jumps to humans, often through the handling and slaughter of wildlife, it can be dangerous as there is little natural immunity to fight it off. What are the symptoms and how serious is it? It appears to start with a fever, a cough or shortness of breath and can lead to more serious pneumonia-like complications. Experts say medical authorities have unlocked the genetic code of the virus, which is about 75% similar to the SARS strain, in record time, thanks to cooperation from a Chinese government eager to avoid a repeat of the SARS crisis that saw it accused of a cover-up. The next few weeks will be critical to the world's understanding of the virus, says infectious disease specialist Sanjaya Senanayake. While a lot is still unknown, Chinese authorities have warned the new strain is already mutating as it enters a critical stage and its spread picks up speed. The country's health minister, Ma Xiaowei, told reporters on January 26 that, unlike the SARS strain, this new virus is infectious during its 1 to 14-day incubation period, before a person shows symptoms. While experts had at first been skeptical of this unusual finding, Australia's Chief Medical Officer Brendan Murphy said the case of a Chinese national without symptoms who travelled to Germany for a conference and infected 4 people was convincing evidence. The total number of cases is also expected to be much higher than official numbers so far. In the depths of China's winter, many people with milder cases might dismiss them for a common cold, Associate Professor Senanayake says. Its spread has already surpassed the 8,097 people officially diagnosed with SARS. Still, experts have been cautious so far when assessing the new virus's danger, noting at present its cases have been milder overall, and the death toll lower, than both SARS and the other deadly coronavirus MERS, Middle East Respiratory Syndrome. Professor Murphy has said the new outbreak does not appear as severe as those strains, at least so far, but concedes it could be weeks before infected people show symptoms and more cases are highly likely to emerge. No deaths have yet been reported outside of China and 2 of the 4 patients in NSW have already been discharged from hospital. More than 140 people have recovered from the infection worldwide. Meanwhile, an Australian lab has become the first place outside China to successfully replicate the virus, a breakthrough that will now help the CSIRO begin testing vaccines within 6 weeks. How is it spread? Coronaviruses are commonly carried by bats and then passed into humans through mammals sold at live animal markets. Previously, Chinese authorities had claimed it could only be passed from animal to humans. But on January 20, they revealed that at least 2 people infected had never set foot in Wuhan during the outbreak. Zhang Nanshan, a top Chinese expert investigating the virus, told state media the people had caught the virus from family members and medical workers had also been infected. He warned it was now certainly a human-to-human transmission phenomenon, and such cases have since been recorded in Japan, Germany, Canada and Vietnam. The virus has hit at the worst possible time for China, Senanayake says. Amid Lunar New Year celebrations, Professor James McCaw at the University of Melbourne is part of a working group urgently convened by the WHO to try to model the spread of the virus. So far their work shows each infected person tends to infect 3 others. That makes it more infectious than the flu but less infectious than SARS and much less infectious than measles, where 1 person is likely to infect up to 20 people. How can you catch it? Senanayake says he expects the virus will spread in a similar fashion to SARS. People will catch it the way they catch a cold, from close contact with infected people, animals or contaminated surfaces. Close contact means at least 15 minutes of face-to-face conversation with someone infectious, according to NSW Health, or at least 2 hours in an enclosed space together. A spokeswoman said that when new confirmed cases of the virus emerged following air travel, NSW Health contacted passengers who traveled 2 rows in front, behind or in the same row as a person at the time they were infectious, as that was considered close contact. Epidemiology expert Ben Polkinghorne said that at the moment, due to an abundance of caution, Australian authorities were advising people who had come into both close and casual, less than 15 minutes, contact with a confirmed case of the new virus to self-isolate for 14 days. Those with symptoms should call ahead before visiting their GP and wear a face mask. Some jurisdictions like NSW are waiving fees for medical treatment. The WHO says the key to minimizing the outbreak is to identify cases early and engage in proper infection control. For the general public that means frequent washing of hands, and it can include covering the nose and mouth to prevent transmission of airborne droplets, though catching the virus in public spaces is considered less likely. Sananayake notes masks are only effective at blocking airborne viruses for the first few hours and should be changed regularly. With SARS, there wasn't one group of people who caught it, but how people reacted did depend on their health, Sananayake says. Antibiotics do not work on the virus as it is not caused by a bacteria. As with most respiratory illnesses, it seems those most at risk are the elderly and people with underlying conditions. Is this another SARS? Hanging over the emergency is the shadow of SARS, which also spread from a live animal market in China and went on to kill nearly 800 people globally. That outbreak was eventually traced back to a colony of bats and was believed to have been passed on to humans via the Himalayan palm civet, an ancient species of mammal eaten as a delicacy in China. Authorities suspect the new virus is also linked to the illegal wildlife trade, sparking renewed calls for tougher regulation after a push to rein in wild animal markets in the wake of SARS failed. Wild and often poached animals packed together and then butchered in Chinese markets can be incubators for viruses to evolve and jump the species barrier to humans. As it steps up containment efforts, China has banned the wildlife trade across the nation, including the shipping and sale of species. It has quarantined breeding sites and warned people against the consumption of wild animals. Conservation groups and experts are now calling on China to make the ban on wildlife trade permanent, warning the nation has not learnt the lesson of SARS. On January 30th, the WHO declared the outbreak a global health emergency, stressing the decision was not a vote of no confidence in China. Such declarations are usually made when a coordinated international response is needed, such as during the start of Ebola in the Congo and the emergence of Zika virus in the Americas in 2016. Earlier this month, the WHO decided not to declare an emergency but said further evidence of human-to-human transmission beyond China had now made the measure necessary. It will trigger recommendations to all countries such as stepping up monitoring and containment efforts and allow the WHO to query nations on their decisions, though the body has no legal authority to impose sanctions. So how is it being contained? While Chinese authorities had maintained that the spread was still preventable and controllable, on January 22 they began to clamp down on the movement of people across the country. Flights, trains and buses have been shut down out of Wuhan and other cities, leaving people largely shut up indoors, wearing masks to venture out. Medical and food supplies are being rushed in as officials scramble to build makeshift hospitals to contain victims. Large-scale quarantines are rare around the world, even during deadly epidemics, and memories of the secrecy wielded by the Chinese government during the SARS crisis is now fueling some distrust. For months, China parked SARS patients in hotels and drove them around in ambulances to conceal the true number of cases and avoid WHO experts. This time around, China's leader President Xi Jinping has told officials to promptly pass on updates, put lives first and work with international agencies. Anyone who deliberately delays and hides the reporting of virus cases out of his or her own self-interest will be nailed on the pillar of shame for eternity, a notice from Beijing's Central Political and Legal Affairs Commission reads. This week, as confirmed cases skyrocketed, state media quoted Xi as saying he was still confident China would win the battle against the virus he called a devil. Other Chinese officials said that while the virus had spread to at least 18 countries, those patients accounted for less than 1% of cases, suggesting containment measures were mostly working. Countries are also screening for people with symptoms at airports, including the US and Australia, as many flight paths from central China shutter. On January 23, the last flight from Wuhan arrived in Sydney with passengers saying Chinese authorities had checked their temperatures. Australian health authorities have stockpiled 10 million masks and are now tracing people who shared flights with infected patients. Since the terror of SARS and then MERS in 2012, Sananayake says screening and quarantine methods have improved around the world. Still, we are vulnerable to a superbug or virus at any time. On social media, people are posting prevention advice such as wearing masks and washing hands. Many cancelled their travel plans for Lunar New Year. But misinformation and even xenophobia is also spreading fast as panic picks up. How big is the risk to Australia? While experts acknowledge Australia is vulnerable to the outbreak, given its high influx of travelers from China, Professor Murphy also says the chances of catching the new virus from fellow plane passengers is likely to be low. There is no reason for alarm in the general community, said Victorian State Health Minister, Jenny Mikakos, following the first revelation of an Australian case, a man in Melbourne with pneumonia on January 25. Prime Minister Scott Morrison has announced coronavirus is now a listed disease in Australia, allowing the country to beef up border control measures. But the government has stressed there are well-established mechanisms and resources in place to deal with the virus. Australia has raised the level of travel advice for China, urging people to reconsider plans to visit the nation. But, despite demands by the Transport Union, Australia has not moved to suspend flights from China, as countries such as Italy have done. On January 29, Mr. Morrison announced a plan to evacuate the 600-odd Australians from Wuhan to Christmas Island, where they will be held for a 14-day observation in the near-empty detention centre. Priority will be given to young children and the elderly, and passage will cost each person $1,000. But the proposal, which is still awaiting approval from China, has already drawn criticism from some medical experts as well as those on Christmas Island who raised concerns about becoming a leper colony. Almost 200 Americans have already been evacuated from the city and placed under a 3-day quarantine at a Southern California military base for testing and monitoring. Japan has flown even more of its citizens home, at least 3 have tested positive for the virus and 9 others show symptoms so far, as France, New Zealand and other countries make plans to pull out their own citizens. With Dana McCauley, Rachel Clune, Eric Bagshaw, Liam Mannix and agencies.